my name is Samuel Boyd, and I'm here to tell you the difference between AIDS and HIV. What does HIV stand for? HIV stands for Human Immunodeficiency Virus. What does AIDS stand for? AIDS stands for Acquired Immune Deficiency Virus. What are the causes of the disease HIV? HIV is a sexually transmitted disease. This means HIV can be transmitted 3 ways. HIV can be transmitted by blood, semen, and vaginal fluid. Also not mentioned in this, without sexual intercourse, it can also be transmitted through breast milk. What are the causes of AIDS? AIDS is not a transmittable disease. It is acquired after you have HIV and lost CD4 cells until you have dropped below the count of 200. What are the symptoms of HIV? Fever, swollen glands, sore throat, rash, fatigue, sore joints and muscles, and headache. What are the symptoms of AIDS? Easy bruising, severe long-lasting diarrhea, unexplained weight loss, shortness of breath, purplish spots on the skin that don't go away. What is the difference between HIV and AIDS? HIV is a sexually transmitted disease transmitted by unprotected sex. AIDS cannot be acquired by anything but by having the disease HIV. This meaning AIDS cannot be acquired in just one day like HIV can. HIV is a sexually transmitted disease, meaning you have to have sexual intercourse with a person to acquire this disease. AIDS is basically, the best way I can describe it, is a category of HIV. So once you progress so far into having HIV, you'll technically have AIDS. HIV is what you actually have. AIDS is just a categorization of what you're under. How is HIV detected? If you give blood and not enough antibodies are detected, the ELISA test, FDMA home test, the saliva check swab test, the viral load test, Western blot test, and if you gain severe symptoms, which would make it apparent. How is AIDS detected? HIV antibody blood test and the RNA blood test. These are some pictures to show you what HIV looks like. These are some skin lesions. They can pop up all around the body. A lot of them are detected mainly where you contract the disease first. So that's what those look like. This is on the tongue. This seems to be on the back of the neck area. What does AIDS look like? These are AIDS skin lesions. So you can still see these on the inside of the gums right here. Kind of like the white blotchy spots you saw on the tongue earlier. Some down here and some up here. And then this is on the back. You can see, or you might not be able to see in the video as well, but there's a lot of purple bruising around here. And then some really dark skin lesions that are purple as well. HIV prevention, use protection, know if your partner's positive, don't inject drugs, and limit the number of sexual partners. HIV can also be spread through needle injections. That's a big problem with like the homeless population, people injecting drugs, just reusing needles. That's how they pick up HIV and get AIDS. AIDS prevention. Avoid sexual contact with people that have HIV and avoid bodily fluid contact. Obviously limit your sexual partners as many as you can. If you really want to be protected from having HIV or AIDS, abstinency is the way to go. Is there a cure for HIV? There's currently no cure for HIV. You can take a combination of pills. This will help alleviate the symptoms, and then it'll also keep your blood, your cell count from going below 200, which will keep you from having AIDS. That's one of the main things, like Magic Johnson. Magic Johnson was one of the first successful AIDS people that have AIDS, and he had enough money at the time to keep enough medication in his body to keep his cell count above 200. Is there an AIDS cure? Currently, there's no cure for AIDS, and it's the same treatment as HIV. So a bunch of medication that's prescribed to you, and you just have to keep taking it. And that is all. Thank you.